How to screen for pancreatic cancer. The pancreas has critical roles in digesting food, and it excretes several hormones, including ones for sugar metabolism, including insulin and glucagon. Pancreatic cancer has been notoriously challenging for doctors to find and diagnose in the early stages. It does not cause early illness symptoms, so when later-stage illness causes disturbing symptoms and cancer is diagnosed, it is usually too late for curative treatment. There is not any one-step or simple set of tests for detecting it in early stages. The good news, however, is that high-risk people, due to their genetics family history of pancreatic cancer, explained below, can receive complex, repeated screening tests over the years when the cancer is more likely to occur. How long an individual cancer patient will live and whether he or she will, or will not, die from the disease depend on many factors, including whether the cancer is slow or fast-growing, how much the cancer has spread in the body, whether effective treatments are available, the person's overall health, and whether the blood vessels and nerves get encased and involved with cancer. Method 1: Screening people at high risk. 1. Determine whether or not you are at high risk. If you have had 2 or more first-degree relatives with pancreatic cancer, you are deemed high risk. Alternatively, if you have had 1 first-degree relative with pancreatic cancer diagnosed under the age of 50, you are also categorized as high risk. Being high risk makes you eligible for screening tests for pancreatic cancer that are not currently made available to the general population. You may also be categorized as high risk if you test positive for a genetic syndrome that has been linked to a heightened risk of pancreatic cancer. 2. Book an appointment with a genetic counselor, doctor, or other healthcare professional who is thoroughly trained in analysis of genetic tests. This person can help you individually and your family understand their test options and results. Your doctor would need access to a lab that does genetic testing, if you suspect this may apply to you. Approximately 10% of pancreatic cancers are linked to genetic causes, and individuals who fall into the high-risk category due to these causes are eligible for screening. 3. Consider a CT, based on X-ray radiation, has safety concerns, versus MRI scan, magnetic resonance imaging, problematic for recently installed stents, any other metal devices, plates, screws, pins, etc. The CT or MRI method of screening is available for high-risk individuals. The challenge with a CT or MRI scan is that it can be very hard to detect early or very small lesions on the pancreas or spreading to the duodenum, gallbladder, liver and such with imaging techniques alone. However, it is better than nothing, and they are the best imaging options currently available. It is also a quick and non-invasive test. 4. Opt for a procedural screening test. Instead of a CT or MRI scan, you can choose an ERCP, endoscopic retrograde cholangiopancreatography, or an EUS, endoscopic ultrasound. Both of these rely on tubing being inserted into your digestive tract through your mouth while you are sleeping under anesthesia to closely examine the pancreas and surrounding areas first without contrast and minutes later with iodine dye. They are internal tests that involve some risks of bleeding or infection, and are more complex to perform, but can provide your doctor with a chance to see first-hand how your pancreas looks, and whether there are any suspicious or concerning lesions or tumors present there or nearby, that may indicate potential cancer. 5. Know that there are currently no set guidelines around screening. Although there is consensus that screening should be made available to high-risk individuals, the frequency and type of screening test is determined on a case-by-case basis. In the future, there will likely be medical guidelines and recommendations, protocol, however, since screening is relatively new, it will currently be a decision made between you and your physician care team. Method 2: Screening the general population. 1. Understand that obesity, plus smoking and alcohol use are associated with an increased risk of developing several types of cancer including pancreatic. There are currently no screening tests available for the general population. By the time of diagnosis based on illness, the cancer has usually metastasized, spread, to other areas of the body, meaning that the patient has on average a prognosis of 6 months to 2 years to live following the time of diagnosis. In the USA, 5-year survival rates, perhaps in remission, or not, for some cancers, such as breast, prostate, and thyroid cancers, now exceed 90%. The inability to detect pancreatic cancer earlier with simple screening tests is a huge problem. As such, it has become an important focus of medical research today. The reason that there are no useful cancer blood screening tests available for the general population, those who are not at high risk, are because the current blood tests being considered by medical professionals are not reliable or accurate, and they provide no significant improvement at detecting pancreatic cancer early. The other screening options, those that directly visualize the pancreas and are offered to high-risk people, are more accurate but are too costly to the patients and medical system for general use. 2. Try as you may to be alert, but most pancreatic tumors form in exocrine cells that do not secrete hormones, also do not cause any signs or symptoms until after the cancer spreads. This makes it too unlikely for the patient to ask for a diagnosis, as it does not cause one to feel sick, and also much harder to diagnose such pancreatic cancers in a timely manner. Also, for most patients with this sneaky, exocrine pancreatic cancer, current treatments do not cure the cancer. A hopeful cure for a rare, malignant pancreatic tumor type arising from islet cells, neuroendocrine, PNET, has a much better prognosis than pancreatic exocrine cancers with approved medications for them. 3. Recognize the symptoms of pancreatic cancer. Since the general population is not currently offered screening for pancreatic cancer, if you begin to notice suspicious symptoms, it is important to book an appointment with your doctor as soon as possible. He or she can then order investigative tests to determine whether or not it is cancer. Common symptoms of pancreatic cancer include yellow discoloration of your skin and of the whites of your eyes, called jaundice, caused by high liver enzymes such as bilirubin, red bile. Pain in your upper abdomen that may radiate to your back and back of the rib cage. Unexplained weight loss, because of sugar metabolism problems caused by the diseased pancreas. Decreased appetite, as food tastes differently if you have yellow jaundice. 4. Know that a blood test may become available in the future. The ideal type of screening test would be a blood test, because it is cheap, easy, and can be readily administered to a large number of people. The purpose of the blood test would be to test for some sort of markers that are shown to be correlated with a heightened risk of pancreatic cancer. Those who are deemed to be at heightened risk from the screening blood test would then receive more detailed testing from their physician to determine whether or not there is in fact any cancer present. 5. Keep up with the medical research. There is a lot of exciting research going on at the moment in the areas of genetics, proteomics, the evaluation of specific proteins that may be correlated with pancreatic cancer, and other biomarkers, substances that can be measured in the body that may correlate to the early detection of pancreatic cancer. Hopefully in the near future enough information will be gathered for the medical community to come up with effective tests that can be made available to the general population to screen for pancreatic cancer. Tips. Transmitting cancer. A person who receives an organ or tissue from a donor who had cancer in the past may be at increased risk of developing a transplant-related cancer in the future. However, that risk is extremely low, about 2 cases of cancer per 10,000 organ transplants. Doctors avoid the use of organs or tissue from donors who have a history of cancer. Spreading cancer. That surgery or a tumor biopsy will cause cancer to spread in the body to other parts of the body is extremely low. Merely following standard procedures, surgeons use special methods and take many steps to prevent cancer cells from spreading during biopsies or surgery to remove tumors. For example, if they must remove tissue from more than one area of the body, they use different, sterile, surgical tools for each area. One kind of pancreatic cancer is the big killer, adenocarcinoma, which accounts for the vast majority of pancreatic cancer cases. They are tumors arising from ordinary, harmless epithelial cells that line pancreatic ducts, and also line or cover organs, bodily cavities and surfaces of blood vessels throughout the body. 90 to 95% of cancers are non-hereditary, but are spontaneous, caused by mutations that happen during a person's lifetime as a result of cellular changes due to aging and exposure to environmental factors, such as tobacco smoke and radiation. Warnings. Cancers may be caused by certain viruses, some types of human papillomavirus, or HPV, for example, and bacteria, such as Helicobacter pylori, in some people. Bad news. But, while a virus or bacterium can spread from person to person, the cancers they sometimes may cause cannot spread from person to person. The good news. Kinds of food you eat, cured with nitrates, consuming much smoked foods, how much you eat, obesity, and whether you exercise, stay fit, may also influence your risk of developing cancer.